Hey, what's up, everybody? We're going to be talking about what are the cons of actually getting a diagnosis of ADHD. Not having ADHD, but the con of actually having the diagnosis of ADHD, having that label. What are the cons? So let's get started right after this intro. Welcome back, my Optimal Mind performers, my Optimal Mind leaders. Let's go ahead and dive in. I am Dr. LeGrand. I have ADHD and dyslexia, and we're going to talk about what are the cons, basically, when it comes to having the diagnosis of ADHD, having that label specifically. Not here to talk about what are the cons of having ADHD in general, but what are the cons of actually going and actually getting that initial diagnosis and then finally having that diagnosis of the label of ADHD. So the very first thing that I think is a big con, because I'm actually in the medical industry, I do see patients with ADHD. I have ADHD myself. And so I'm a family doctor, and I see this amongst a lot of my colleagues, amongst a lot of my doctor friends, and what happens when you have that diagnosis of ADHD and you go and see a doctor. The problem is with any kind of diagnosis, and it doesn't even have to be just ADHD. It could be depression, anxiety, it could be hypertension or diabetes. You get labeled as, okay, he's coming in, he has ADHD or he has diabetes. And the problem with that is they will treat you as such. And what I mean by that, and this is where it really becomes a problem, is when you have ADHD, and let's say you come in for having issue with fatigue. Well, the very first thing they'll go to, which isn't wrong, is they'll think they need to switch out your medication because there's medications, ADHD medications that can cause fatigue. But then you switch that medication and you're still having the issue, so they'll think about switching it or changing the dosage. So you go through this vicious cycle. The problem with that is they don't think the other possibility things that could be contributing to fatigue, because there's a lot of things that could be contributing to fatigue. But because you have the diagnosis of ADHD, guess what? They're going to go through that vicious cycle of always looking at you with just looking at your mind, your mental health issue, versus looking at you as a whole. Basically treating you as an individual, because not one ADHD person is the same. So having that diagnosis, that's a con in itself. And so that's why I think it can be an issue, and it's important to seek out somebody that looks at more of a more holistic approach of looking at possibilities that could be contributing to the ADHD, because there's a lot of things that could be contributing to just the inattentiveness. It isn't always just ADHD. There's other possible health conditions that could be contributing to that. There's other possible health conditions that could be contributing to the impulsivity, as well as the hyperactivity. All these different struggles that we deal with on a daily basis with ADHD could be other possible contributing factors, especially if it's starting to get worse. It isn't always necessarily the ADHD. It isn't always necessarily the medication, but it could be other contributing factors, and that's why it is a problem of having that label. The second thing, and I know this is a very sensitive topic, but this is so true amongst people who have ADHD. Sometimes we, and I am also included myself, at a time and point in my life where we use this as an excuse. Oh, I have ADHD. That's why I can't learn well. Oh, I have ADHD. That's why I can't concentrate. Oh, I have ADHD, and that's why I can't be successful or happy in life. It's an excuse. It's a crutch. I get it. I have ADHD. It is a challenge having ADHD, but it shouldn't stop us. It shouldn't put excuses in front of us of not succeeding in life and actually achieving what we need to achieve. We do need to work harder than most people, but that's okay. Sometimes having a bigger challenge makes us become greater than the average person. Who wants to be average? It's better to actually have a challenge and be able to succeed it and be able to live with your ADHD, and it's a part of you. Have it become a part of you. But if you start using it as an excuse, that's the problem of having the diagnosis of ADHD. So many people are so eager to go get a diagnosis of ADHD because they think that's going to cure it. It's going to all of a sudden magically make their life better. It doesn't. Trust me. I've seen plenty of patients. They finally go get the diagnosis, and it all of a sudden didn't make their life better. So, okay, great. I have the label now. You know, it might be helpful in schools to get extra additional help and stuff like that, but then they're also treating you differently. Do you want to be treated that different? I don't know. It really depends on how severe your ADHD is, but the main reason that you should not be wanting to use ADHD as an excuse. You have that diagnosis, try to avoid saying to yourself, oh, it's because of my ADHD. Just try, okay, how can I do better? How can I improve upon that? So stop trying to use ADHD as an excuse and use it as something that you can actually achieve more and kind of get over that and use ADHD as part of you so that you can succeed and get above the average person. The third thing, and this actually kind of relates back to the first, but this has to do relate more to you versus doctors, is having that label of ADHD also prevents you thinking it could be possible other conditions and reasons that could be contributing to your ADHD symptoms. So just like the doctor, they might just think it has to do with your ADHD and you have to change medications. So you go through the same process as with yourself. Whenever you're having a spurt moment of a weird day that's just off, or a week or month where you're either more tired or more hyperactive, you're more moody, you just think, oh, it's just my ADHD. And you put it off. And then there goes your health. Because you put it off for years and you just think it's part of your ADHD. And lo and behold, it was probably because you were anemic, or it was probably because you had some issue with, maybe possibly issues with diabetes, or something to do with your digestion, or something to do with, an allergy. Who knows? It could be a number of different things. But when you start using ADHD as the excuse of like, oh, it's just my ADHD, that's probably why I'm acting like this. This is why it's kind of changed. Then that really prevents you from actually reaching optimal levels of health. So I need you to understand these three things as you try to not use ADHD, get so eager to try to go get that label. I'm not saying that you shouldn't, but when you do have that label, try to not use that as an excuse label, and try to not have your doctors use it as an excuse label. Try to ask them to actually encourage them to start looking at other possibilities that could be contributing to those symptoms versus just changing your medication, okay? Or changing your dosage. I mean, this is so important. This is what I see all the time with patients coming in having these issues, and these are what I address. Because to have optimal levels of health, or just optimal ADHD health, is you need to be seeking out these things as far as when it comes to not always labeling, but looking at you as a whole and as an individual. That's what I primarily focus on. And if you're trying to seek, well, okay, what labs should I be running? What types of nutrients should I be doing? How do I make this more individualized to me and specific? I have a downloadable guide that kind of helps you guide as far as what labs you should be running and asking your doctor. So they're not just looking at just your ADHD, but your overall health, and also implementing other types of nutrient supplements, what foods you should be avoiding and also implementing. And that description is in below to download that guide. And I hope you guys found this valuable and really grasp this concept. Until next time, this is Dr. LeGrand signing out. And remember, you have an optimal mind. Thanks. Bye.